Can erectile dysfunction be cured? And the answer is yes. Erectile dysfunction can be cured. There are a lot of options out there and a lot of different things you can do. So if you are experiencing erectile dysfunction, I know you guys are going to go online. I know you're going to search for some alternatives out there. You're going to try to find the path of least resistance to get you your results of better erections. So wherever you are on this journey, that's fine. That's completely fine. It's about gathering up the information. But if you ever run into a roadblock, that's whenever you guys need to reach out to the Phoenix Men's Health Center. That's when you guys need to reach out to men's health specialists, sexual health specialists, and people who deal with hormones, in particular testosterone, because all of these can be related to erectile dysfunction. When we talk about erectile dysfunction, people are always trying to look for that simple solution. And I get it, right? This is a very personal subject. It's a private subject, and oftentimes people don't want to talk about it. Now, hopefully here, we can help to open that up a little bit. So I really encourage you guys to ask us any kind of questions you have, because it's only going to help hundreds, if not thousands of other men help to find out their solution to curing their ED. So remember, ED can be cured. There are a lot of solutions out there. So let's go ahead and start addressing some of those. So which erectile dysfunction drug is the best? There are a lot of drugs. And I want to preface this by saying the drugs are not necessarily always a solution. There's a lot of ways to treat ED, a lot of ways. There's a lot of natural things you can do. Believe it or not, there's actual manual things that you can do. There's injectable medications. And of course, there's oral pills. There are peptides. You name it, there is a solution for curing ED. So first and foremost, ED is not permanent. And ED can be cured regardless of what your situation is, even as extreme as a prostatectomy. That's whenever your prostate is removed. A lot of guys out of that procedure are going to experience erectile dysfunction and really struggle with it. We have solutions here for you guys. So in terms of trying to break this down, because it's so much data, there's so much information to try to gather in, always keep in mind, it is not necessarily tit for tat. What I mean by that, if somebody says, this is the best, no, that's not true. There is no such thing in this world and in the world of medicine that this is the best, right? Because remember, you guys are comprehensive organisms. You guys work in a lot of different ways, and we have to look at the whole picture of your health. Now, let's just talk about just the oral drugs, right? These are oral pills in this kind of category. Here we have something that's called, you guys definitely have heard of Cialis, or the generic name is Tadalafil. And I know you guys have heard of Viagra, and the generic name is Sildenafil. There's others that are called Sildenafil. So you notice a lot of these drugs sound the same. Then you have Levitra that's in that same category. So a lot of these drugs are basically working off the same way. And the way these drugs work is they're going to basically open up the blood flow in your penis, but not just your penis, your whole body. The nice thing about these drugs, it's almost like a switch. It's almost like a key. Whenever this drug is in your system, it's going to be involved in all of your blood vessels. And basically, whenever you get sexually aroused, the testosterone in your system is going to be, throughout your whole system, you get a signal from your brain, and then your brain's going to send out chemicals that are going to tell the receptors in the blood vessels of your penis to open up. These drugs just help that process. They just help that receptor work better. So whenever you're taking these medications, you're going to need all these things combined. You're going to need really good testosterone levels. You're going to have some kind of sexual stimuli. You're going to have to be mentally, relaxed in the state of wanting to engage in intercourse. And then when you have the drug on board, it's going to help to open up those blood vessels. So the nice thing about this one here in particular, this is going to be Tadalafil, right? AKA generic Cialis. I always call this one my weekend pill. The nice thing about this thing, you take it Friday afternoon, after work, Friday 1, 2 o'clock. By the time Friday evening kicks in, Saturday, you can even spill over into Sunday morning. This should be doing you just fine. Out of the medications that we're talking about, this is my favorite. The reason this is my favorite because it also tends to have the least amount of side effects. So remember, with these medications, not only going to help with the blood flow in your penis, but it's also going to help with blood flow in your brain. Now we are discovering that in terms of dementia, this is helping guys with dementia. Dementia is essentially a decrease of blood flow to your brain tissue. So when your brain's not getting enough blood over the course of time, it's being starved of oxygen. When your brain is starved of oxygen over an extended period of time, dementia. So with these medications, we're discovering it's helping the blood flow, not just in the penis, but in the brain. Blood flow in medicine is everything. Your organs want blood because blood's going to be carrying nutrients and oxygen. So if we can take this kind of a medication, remember this comes in a daily dose as well. As a daily dose, how cool is that we can help with multiple conditions? So I'm a huge fan of these medications. I think they're excellent. I think they're awesome. They're very safe. They're very effective. Now, they can lower your blood pressure. So if there's any negative side effect, probably the biggest thing is a decrease in blood pressure. So if guys are taking current blood pressure medications, it could just lower the blood pressure even further. So you do have to take caution. You do need a prescription. You should be working with a physician for these. I do encourage you guys to seek out a medical professional to do this correctly. I know that you guys can find this stuff online. I know you can get it for cheap, but you don't really know exactly what you're getting, the quality or the strength of it. And if something goes wrong, you have no one to turn to. And then here is just a sample of a generic Sildenafil, generic Viagra, aka Sildenafil. I call this my heading home from the bar, I just got lucky. At least you think you're going to get lucky. So you discovered that you are going to be able to have a great opportunity this evening and you need something because you want to be sure that you can perform. That's where these come into play. So the nice thing about these is they work fast, anywhere from 20 to 30 minutes on an empty stomach. Now, that 20 to 30 minute mark, I tell my guys, you know what? Don't count on that. Give it an hour and a half, really, to be in your system before you start to notice anything. So if you're going to be taking this, I suggest you take these medications about an hour or two before you want to engage in sexual intercourse. Now, with this medication happening quickly, the generic Viagra, aka Sildenafil, it's also going to be out of your system faster too. So in about 4 to 6 hours, it's going to be out of your system. So this is good for people who kind of want that, I guess you could say, kind of on-demand performance. And then while the other one we were talking about, the Tadalafil, is going to be more, they want to be ready whenever they're ready. That's why we call it the weekend pill. Now, which one's going to be stronger? They can both work. They can definitely both do what they're supposed to do. So it's all going to depend on your dosing and also where you're at. So when I mean where you're at, I mean like where's your testosterone levels, what's your age, what are the other comorbidities that you have? Comorbidities, do I have heart disease? Do I have diabetes? Do I have low testosterone? Am I overweight? Am I obese? Am I alcoholic? Do I smoke a lot? These other things all play a role into how well these work, simply because how well is your body working? So it's not necessarily the drug, but how well does your overall system work? So here we got the Tadalafil, here we got the Sildenafil, others are Vardenafil, aka generic Levitra, but these are probably the two most common, and there are a few others as well. So that just gives you a little bit of insight as to some of the medications. Some of the ones that we use here at the practice, they work really well. They're super awesome. We now got them in a generic form. Remember, with all these medications, there is a potential for side effects such as decreased blood pressure. Some guys can get some discomfort in their lower back and their legs and the big muscles in their body. So that's something else can happen too. And if you're taking a lot of these constantly, it's going to affect your blood pressure. So you want to be sure you have everything in balance.